nutrition. What you want to know about this nutrition is if she has food taboo, if she eats well, and if she's actually tolerating food well. So all these things you have to ask the patient, and in case she has any food taboo, you indicate. If she has some food that she doesn't eat, you indicate here, and it must be well written. Even if she has allergy, it must be also noted also as per nutrition. Moving on to elimination. In elimination, you have to ask the patients the pattern of micturition. Does she micturate at night while sleeping, and how many times? Does she have frequency and urgency of micturition? You have to note all those things, and it must be well documented. And asking about the defecation also, you ask her about the elimination pattern as well, about the defecation, if watery, if hard, and the color, the texture. Those kind of a thing must also be asked, and it must be well documented as well. Moving on to activities and exercise, we want to know the type of activities that the patient is being engaged in. If the patient had been sedentary lifestyle, if she's agile, you have to know if active, if she engages in any form of exercise. All these things must be noted. And sleep and rest, we have to know if the patient sleeps well. How are you going to know this? You have to ask for how many hours she sleeps at night, and does she observe siesta, and how many hours as well. This also must be well documented. Asking about communication and special senses, you have to ask her here those languages that she understands, those languages that she could speak. Like, for example, does she speak Yoruba? Does she speak Hausa, Igbo, that kind of a thing? And also, you have to ask her about her special senses. And how are you going to ask this? You ask her, does she wear glasses? Does she see well? Does she see things that are far, or does she see things that are nearer, closer to her? So all these things also must be noted. If she uses glasses, it must be written. And about the hearing aid, you ask her if she's using about special sense in the ear, the ears, how she's able to hear things. Does she use hearing aid? Does she experience any form of discharge? That kind of a thing too must be noted. And any kind of deformity seen, or any kind of challenges as per the special senses must also be well documented. Moving on to feeling about self-image, how do you want to ask this? Ask her